Hi guys, my name's Rowan and this is
Frederik
of the KNEEteam of Fysiosportief. And today we're going to be talking about the pros and cons of having surgery after you've torn your ACL or your anterior cruciate ligament, one of the important ligaments in the knee that provides stability during sports or daily activities.
Yeah, we're going to provide you with some general guidelines whether or not you should get surgery or should not get surgery. But it's important to notice that the things we tell you now is about an isolated ACL tear. So there's no other things happened in the knee like meniscal tears or other injuries. And also keep in mind that these are some general guidelines, but always confer with your orthopedic surgeon whether or not it is important for you to either get a surgery, an ACL reconstruction or not.
When you tear your ACL, there's two ways that you can address this. Either you get surgery or you stick with the non-invasive physiotherapy rehab on your knee.
Definitely. So what happens when you tear your ACL? Your knee gets swollen up. Often you have a limitation of your range of motion, and of course there you will feel pain in the knee. So first what we need to get to do is get that knee to lessen like the swelling. And to get its normal range of motion back. So that takes about 3 to 6 weeks before the swelling is kind of gone and you have a normal range of motion again. After that period, we can start with the rehabilitation, which takes about 3 months, in which we strengthen the knee and try to stabilize it. After 3 months, we evaluate the knee. If it is still unstable, you can decide to do a different kind of sports or do the sport on a lower level or adjust your activities. Also, you can decide to try to extend the rehabilitation period and see if you can get more stability in the knee, or you can choose to get a surgery anyways.
So when you do choose to get surgery, you will confer with your orthopedic surgeon what approach is best for you. Also, the same starting period will be 3 to 6 weeks, which the knee needs to calm down before any invasive procedure will happen. Then, with your orthopedic surgeon, you'll choose between either a hamstring graft or a patella tendon graft, depending on the sport you do. And after the surgery, you'll probably go home the same day. Then when you get home, it's important that you use crutches for 3 to 6 weeks, depending on your level of fitness beforehand and after the surgery, and you'll use some painkillers to deal with the initial pain.
Also, before surgery, it's important that you get at least 80% of your quadricep strength back according in relativity to your other knee. So it's important that before surgery you also do rehabilitation to strengthen the knee, so you will get better results after the surgery.
After surgery, the physical therapy rehab takes about 9 to 12 months, depending on the sport that you want to play and also the goals that you have. Now, also on top of that, about 65% of the people who do get surgery return to their sport at the level prior. So about 35% don't. Whereas if you don't get surgery?
Yeah, for the non-invasive treatment, it's about 50% of the people that reach the level of sports and activities that they had beforehand. And the other 50% don't achieve the stability in the knee and decide to get surgery anyways.
Now, if you do get surgery or you don't get surgery, there's always going to be a certain level of wear and tear that happens in the knee because of the initial ACL rupture. So that doesn't really matter which procedure you choose to do.
Yeah, so remember, whether or not you do surgery or not, there's always a chance that you don't reach the same level of activity as you had before.
So what are the risks of these procedures?
Well, if you decide not to get surgery on your knee, there is a chance that you will have a moment of giving way. And that means that there is a sudden movement in which your knee gets unstable. And that can cause other damage in your knee joint because the knee doesn't get limited by your ACL anymore, so it has a bit more instability. Well, if you experience a moment like that, you can get cartilage trauma or trauma on your meniscus. So that's always a risk on doing the non-invasive rehabilitation.
Now, if you do get surgery, about 1 in 10, so 10% of the people who do get surgery injures that same knee again. So ruptures the same ACL or the new ACL. And also on top of that, you have an increased risk of injuring that same knee or the other knee in the same manner. After surgery, there's also the possibility of a lasting loss of sensory loss on the front of the shin or pain where they took the tendon to make their new ligament.
Yeah. So when can you do what again? If I say that correctly.
Yeah.
It takes about 3 to 6 weeks. If you do the non-invasive treatment, it takes about 3 to 6 weeks for you to reach your your daily activity level in which you can do cycling and driving your car again. It is important that you feel safe to do this because, of course, if you have a sudden moment where you have to react, the knee has to be stable enough to react in that situation.
The same goes for surgery, also 3 to 6 weeks. Obviously the approach is going to be slightly different, but in 3 to 6 weeks you'll probably be able to do your daily activities.
So when you're looking at sportive activities on the longer term, say about 5 years, there's about 50% of the people that don't get surgery that still do sports. There is about 21% of the people that do the sporting on the level as they were used to before they got their ACL torn. So that is not that much.
No. So the 65% that we saw previously with the surgical procedure, that also holds true for about 2 years. So after 2 years after surgery, there's about 65% who are still doing sports on their old level.
That's a bit more.
That's a bit more.
Yeah. So this was a short summary on the consequences and expectations whether or not to do surgery on your ACL tear. Factors always include age, instability of the knee, your level of activities and sports, your expectations, your own goals, which you will, of course, take into account whether or not you want to do an ACL reconstruction or not.
And on top of that, it's always important to see every case as an individual and for you to confer with either your orthopedic surgeon and your physical therapist which approach would be best for you.
So if you have any more questions or if you would like to make an appointment, then you can just click the link that is in the description. Also, we have our own Instagram page called Fysiosportief KNEEteam. I will add it in the video. You can visit that for some nice exercises and some other videos. Most of them are in Dutch though still, so I hope that wouldn't be a problem. And yeah, what can I say?
Thank you very much for watching. I will see you next time.
See you next time. Bye.
Like and subscribe. Don't forget to ring that notification bell and comment whether you've ever had any knee injuries either.